So we will continue with the session. The internal respiration, as we said, there will be exchange of gases between the blood and the tissues. When the blood reaches the tissues, as again it is in the capillaries, which is a thin layer. So the concentration of oxygen is high. So it is opposite to what's happened in the alveoli. So it is opposite to reaction to what's occurred in the lung, or to unloaded from the blood because it has the higher concentration. So it will be unloaded to the tissues, and carbon dioxide, it will be uploaded in the blood. So as we said, in the plasma, the carbon dioxide, it is mostly as a bicarbonate. So CO2 plus water, it will lead to carbonic acid, and carbonic acid, it will give hydrogen ions and bicarbonate. And it will be transferred through the plasma until it reaches the lung. So CO2 combined with water to form carbonic acid, which is quickly dissociate and to form bicarbonate. It will form bicarbonate. Oxygen is released from the hemoglobin and diffused quickly into the blood, out of the blood into the tissues. So the venous blood in systemic circulation, O2 will be full of O2 and rich in carbon dioxide. So it will be loaded with carbon dioxide, and it will be the oxygen, it will be less because it will be there in the tissues. About controlling of respiration. So the learning objective that we will cover for the controlling of respiration, that we have to explain the neural regulation and non-neural function that influence the respiration. So we will take the neural control and the non-neural condition that will control breathing. The neural regulation here, if you see here, we have the bones and medulla. The breathing control center is present there in the medulla oblongata, in the bones, and both bones and the medulla, they are regulating the respiration. So through two nerves, the phrenic nerve, it will give its stimuli to the diaphragm, and the intercostal nerve, it will give the stimulation to the intercostal muscle to contract and relax. So the nerve impulses trigger the contraction of the respiratory muscle, of the inspiratory muscles, the diaphragm and the intercostal muscle. And we said that when the diaphragm is contracted, it will be flattened. So the size of the chest, so it will go down, because the diaphragm, it is like a dome. It is like a dome. When it is contracted, it will become flattened. So it will go down. By going down, when it is going down, so the space inside the chest, it will be more. it will create more negative pressure. And when the intercostal muscle contract, it will raise up the ribs. So the chest cavity, in this case, also it will have more capacity, and this will create more negative pressure inside. So the air, it will come inside during inspiration. So, but how that happened? What is the form that will lead to the stimulation of the breathing center, and then it will send the message through the phrenic nerve and the intercostal nerve to increase its contractility and to increase the number of contraction in order to increase the breathing rate. There are two sensors. One sensor, it is in the arch of the aorta. You know, when the blood, the oxygenated blood is coming out of the heart, it will go through the aorta. The ascending aorta, then the arch of the aorta. In the arch of the aorta, which is in the beginning of the aorta, it has oxygen sensor. So oxygen sensor is there, which will detect the level of oxygen in the blood. So if the level of oxygen is high, in this case, it will send a message to the breathing control that breathing is okay and you can relax slightly. So because of that, the depth of breathing, it will become within normal, and the rate also, it will be within the normal rate of rest. But during, if we are having a high demand of oxygen, if we are doing exercise, if we are doing something, what will happen? The oxygen level, it might be less. So it will be detected, and this will send a message to the breathing control center. Then the breathing control center, it will enhance the, or increase the contractility and also the number of contraction. So the number of contraction, it will be increased. By that, the rate will be increased and the depth is increased. So depending upon the level of oxygen in the blood. The other thing, which is breathing control center, stimulated by carbon dioxide mostly. Carbon dioxide in the blood. That will act directly on the medulla center by causing a drop down in the pH of the CSF. What's the CSF? Cerebrospinal fluid, which is coming around the brain. So, and also inside. So there will be, if the carbon dioxide level increased, in this case, what will happen? It will act directly on the medulla center by causing a drop in the pH of the cerebrospinal fluid. Nerve impulses, so here both nerve impulses from the center here, or the oxygen center in the aortic, or in the arch of the aorta, and the CO2 level in the blood, both of them, they are sending message directly to the breathing center, and the breathing center will analyze it, then it will give the order or the message to the phrenic nerve and to the intercostal nerve in order to increase its contractility and also the rate of contractility. So again, the activity of respiration muscle, diaphragm, and external intercostal muscle is regulated by the nerve impulse transmitted to them, to those muscles from the brain by phrenic nerve and intercostal nerve, neural center or breathing control center that control rhythm, which is the rate, rhythm and rate, and depth are located in the medulla and bone. So the breathing center, it controls the rhythm, the rate, and depth. The breathing control center in the medulla send the basic rhythm of breathing and continue as the pacemaker of self-existing. So it is like the pacemaker, which is give the contractility to the heart, if you remember the SA node. So it is similar to the SA node. Ventral respiration group, also the bones coordinate with the medulla to smoothen out the respiratory rate. So both of them, the bones and medulla, they are coordinating in order to have to moderate the rate, depth of respiration and rhythm in order to maintain the need of oxygen of the tissues, in order to give the demand of oxygen to the tissues and for the process of metabolism. So the normal respiration, we call it eupnea. Eupnea, it means normal breathing. The impulses travel along the phrenic nerve, intercostal nerve to stimulate the diaphragm and external and intercostal muscle and respiration. Normal breathing, it is around 12 to 15. It is up to 20. It is there is a range. This is an adult per minute. Both medulla and bone coordinate to maintain the normal rate, as we said. The increased respiratory rate, we call it the hyperpnea. Hyperpnea, it is increase in the respiratory rate. During exercise, we need more, the demand for oxygen will be more because the muscle will consume more energy. And in order to produce energy, we need nutrient and we need oxygen. So during exercise, we breathe more vigorously and more deeply as the brain center send more impulses to the respiratory muscles to contract in order to give have a breathing. So the rate will be more in case of exercise. We call this hyperapnea. So eupnea, it is the normal breathing in respiration at rest. So again, this is the neural regulation again. There is a center respiratory sensor in the arch of the aorta. So it will detect the concentration of oxygen. When the concentration of oxygen is low, it will send a message to the breathing center to increase its impulses to the phrenic nerve and intercostal nerve. By increasing that impulse and the strength of that impulse, it will lead to strength of contraction. So if the strength of contraction is increased, it means that the breathing, it will be more deep. If the number of stimulation is more, it means that the rate of the breathing will be more, isn't it? So it depends upon the oxygen level. The second thing, which is, or the second stimulation, which is the most the breathing is depending on, is the level of carbon dioxide in the blood plasma. So CO2, when CO2 increase, in the blood, it will act directly on the medulla center by, it will cause a drop in the pH. It will cause acidity, acidosis. So the more hydrogen will be released in our blood. Because of that, it will stimulate also the breathing control, the breathing system. So the non-neural function, it influences the respiratory rate and depth, like physical factors that which can modify the rate and depth of the breathing. When our temperature is high, when it is high, it means that there is more or less metabolism. When our temperature is high, it means that the metabolism is high in our body or less? High. So when it is high, it means that the body is need for more oxygen. So because of that, the breathing rate and depth, it will be increased. So when we have fever, mostly you took that in vital signs and fundamental of nursing, that when fever is there, breathing will be more, and what about the heart rate? Yes, the heart rate will be also more. So the heart rate and breathing rate, it will be more in case of increased temperature. In exercise also, the demand for oxygen will be more. So definitely the depth and rate of oxygen, it has to be more in order to submit a sufficient amount of oxygen to the tissues. When we are talking also, this will affect the breathing. And it is being an effort. There is non-respiratory air movement like coughing, sneezing, and we mentioned those non-respiratory movement. Violation, there is conscious control of breathing. So to some extent, breathing can be controlled. Those who want to dive, they will take a deep breathing, and after that, they will prevent themselves from taking in and out breathing in order to dive, and they will utilize the oxygen which is there in their blood and in their lung to exchange and to give their energy. So we can control ourselves without breathing for a few, it depends, seconds or minutes, according to the training that we have. So we can close our nose and mouth, and in this case we will not be able to breathe for a period of time. It depends upon the training and your ability. So if you are trained more, in this case, you have more ability to. We have also emotional factor, like fear. When fear is there, it is related to the hormonal changes. So those hormonal changes, which will lead to fight and flight. And if you want to fight or if you want to run away, both of them we need energy. In this case, the breathing will be the rate and depth, it will be more, and the pulse will be more, in order to give more oxygen to your blood in order to be able to fight or flight. In case of anger, it is the same. Excitement also can modify breathing. And also, if you remember, in fundamental of nursing, when they taught you how to count the breathing rate, usually we are for all procedure, we are explaining the procedure to the client, except for breathing. We will not tell him that we are going to take his breathing. Why? Because of the ability to control the breathing for a short period of time. So he will be able to control it for a period of time. And your count or thing of the rate, it will be depending upon his control, not the normal thing. The non-neural function has influenced the respiratory depth. We have the chemical factor, as we said before, the oxygen, the carbon dioxide level, change in the blood CO2 level are the most important stimuli affecting respiratory rhythm and depth. So the CO2 increase in the blood, it will act directly, as we said, in the medulla by causing drop in the pH of the CSF, which cause increase in the rate and depth of breathing. And the chemical factor of O2 level, this is just a repetition of what we said before. It will change the oxygen concentration in the blood are detected by the chemoreceptor in the aorta. So chemoreceptor is there in the aorta, and common carotid artery, also in the common carotid artery. The chemoreceptor will send impulse to the medulla when O2 level drop down. So decrease in O2 level become important stimuli only when the level of oxygen are very low. But the normal, on the most, it is the chemical factor due to the CO2, the presence of CO2, which is stimulate the breathing rate and depth. But here, the stimulation will happen mostly if the level of oxygen is dropped down. Thank you. So this is the rest of the, any question? Is it clear?